Hi, I'm Lynn, Managing Director of HRM Home Care, and we provide care services across the west of Scotland. Well, what attracted me to social care was actually working with people and finding out about their lives and being able to help them. It's one of the sectors there's going to be a growing demand to help people, and it's actually about trying to help people improve their quality of life, and that for me is quite an important thing to do. I'm really keen and motivated to find out how I can make life better, how I can help people age well. So we've been calling for the last 20 years for investment in the sector, and really we need to invest in the workforce and invest in the services that are delivering these services. So social care has always been shortchanged in society, and we haven't invested enough in building the infrastructure and this sectoral capability to deliver long-term care supports. And as our population's ageing and the demographics are rising, we need to ensure that we've got long-term solutions to look after people. So really what we need to do is invest in attracting people and retaining and recruiting staff into the sector. That's really important that we do that, and that we let people see that it's a really attractive, rewarding industry to work in. So it's a complicated bag of factors. I think we need to invest in recruiting people into the sector, but we need to tackle the underfunding, we need to tackle the terms and conditions in the sector, and we need to be working more closely with local government and with national government to actually address the funding issues in the sector. Right now what we need to do is make a decision about how we're going to fund long-term care for the future. We need to make a decision about what's the right level of care that we're going to provide. And we need to start talking to people about what their contribution is to improving their own lives. So the most immediate thing is to improve the pay and the terms and conditions of the people who work in the sector. And care providers like me can't do that without the support of local government and national government, because we're contracted to deliver services, and those rates need to improve. If those rates improved and we were able to pay staff more wages, and the terms and conditions improved, then the people who are working in these services would make a better contribution to their own communities. They would be wealthier themselves, they would move themselves to a different economic position, and that would then improve the terms and conditions in the sector, but it would also help attract people to work in the sector, because after all, we're going to need every young person in Scotland to come into the care sector just to meet the demand of the numbers of people that will need care. So we need to find ways to make this an attractive working environment.